Welcome to CCS Conversations, a ColumbiaCare video series dedicated to talking about behavioral health. We want to create awareness and hopefully provide some helpful tips for our audience to take care of their own mental health. And today we have a special guest, Amanda Smith, who is a therapist here at ColumbiaCare Services. Thank you for being here, Amanda.
Yeah, thanks, Jennifer. I'm happy to be here.
So today we are going to talk about terminology, because terminology is really important to understanding your own mental health condition, maybe more effectively reaching out for resources. It can help someone communicate better with their own therapist, which leads to better outcomes. So that's what we're going to tackle today. And specifically, we're going to talk about the term behavioral health, because it is a term that is used a lot and maybe not everyone understands what that term means. And we also hear the term mental health, and then we also hear the term SUD, or substance use disorders. So I would love for you to first just start by defining behavioral health and then defining mental health, if you could.
Yeah, thanks. So behavioral health is more of a broad umbrella term that kind of covers our mental health, our emotional health, and our physical health and well-being. And all of those things are kind of wrapped up together are our behavioral health. Mental health is really specifically sort of looking at our mental processes. So it's really the inner dialogue, the inner psychology of how we think, how we feel, how we engage internally, and the psychology behind that. And also sort of these mental illnesses that are diagnosable, such as substance use disorder. And substance use disorder is a good example of where mental health and behavioral health kind of come together for best outcomes. So it's about that internal piece, the emotions, our thought processes, and things like that. And then our external behaviors and choices and the ways that we interact with the world physically and outwardly.
That's great. That's a great explanation, because there is definitely a relationship between the two. So that's much less confusing when you describe it that way. So behavioral health might be the more outward expression of something that's happening internally, which would be more your mental health. So I'm thinking about how someone might address their behavioral health concerns. I'm wondering, does that have to do with environment and things like that? And then what might they do to address their mental health condition?
Yeah, thank you. So ColumbiaCare has, for example, is really good at kind of addressing holistically all of those things, right? So we serve a person where they're at with their mental health and well-being and their physical health and well-being. And that means addressing things like where they live, where they work, where they learn, where they play, so that these individuals get a more holistic assistance with their health and health outcomes. So one of the things that's interesting is the overlap between mental health and behavioral health, or physical health, is that we know an action, a behavior, a choice, maybe it can come from a thought, right? And that dictates the things that we're choosing. Well, that's the behavior. And so a behavior can be both a cause and effect of a mental health issue, and vice versa. A mental health issue can be both cause and effect of a physical manifestation of a behavior.
That makes a lot of sense. We're a whole people. And so what we do might impact our mental health, and our mental health might impact how we make choices.
Yeah, absolutely.
That's really helpful. So what might a person do if they're struggling with an issue? Where might they get started? How would they know that, and who would they reach out to?
Yeah, so I would say starting with just really understanding that we're not alone. We're not alone in this. That feels first and foremost, right? So when we feel like maybe there are others struggling, others who might understand what we're going through, it's a little easier to reach out for help. So starting there. If we could do it alone, we probably would do it alone. So if we're experiencing symptoms of discomfort with our thinking, with our emotions, with our behaviors, our actions, and our choices, knowing that there is help out there, that's first and foremost. Secondly, some options for seeking support might be going to their primary care physician. And again, knowing these different terms, mental health and behavioral health. Just having those different terms and knowing how to ask for specific help. That's another good place to start. So asking their doctor for a referral for either behavioral health, supporting their actions and decisions, or the mental health piece from a mental health provider, seeking a therapist. At many primary care physician's office, they also now have behavioral health integrated into that, so that referral process can be a little easier. And we're looking at, not just the mental health diagnoses and how we can support those with medications or talk therapy, but we're also looking at the behavioral piece, right? And that substance use disorder piece, the outward expressions of how these mental processes or mental illnesses are manifesting in our lives and the choices that we're making.
It sounds very multifaceted and very connected, which I think
Yes.
is really important for people to understand. So it may be that they don't know that they have a mental health concern or a mental health condition, but they might notice that their lives aren't going quite how they want them to, or a behavior that's becoming problematic in their life or in a relationship. And so to be able to identify that and say, hey, maybe I should reach out for help, and then let someone help determine the path from there would be really good.
Yeah.
So you don't have to know if you have a mental illness. You can say, this is becoming concerning for me. I notice this pattern. I might need to reach out and get some help.
Yeah, something feels off in my life, or even feedback from another person. Sometimes that feeling of feeling off, we can shut down those emotions, right? That's the mental health piece. And then we just keep trucking along. That's the behavioral health piece. And sometimes it takes an outside source to kind of reflect back to us, hey, I'm maybe concerned. And taking that and seeking support is also important.
That's wonderful. One of the most important things I think that you said here today is that, it's common to have a concern like this, that mental health treatment is available and people actually get better. It's a ColumbiaCare term we use all the time.
Yeah.
And so that's sort of that trio is, it's okay if you're having a concern. You're not alone. Help is available, and go get the support that you need, because it can improve your life quite a bit, and there's support available for people.
Yeah, absolutely.
Well, thank you so much for being here. As always, if you are experiencing a mental health concern, reach out, get help, people get better. And if you're experiencing what you believe is a crisis, something more urgent, please text 988, or you can give them a call as well. Take care.